The demand for mental health services in Northamptonshire has both grown, but it's also changed. So we've seen an 82% increase in our use of crisis cafes, an 86% increase in the use of our crisis houses, but we've also seen a 27% increase in the number of people being admitted for inpatient mental health care. And we've seen a 110% increase in people being referred with a first episode of psychosis. There's no doubt that the need for mental health support has increased, but the way it's changed is that people are coming forward with greater levels of acuity and severity and complexity, and that's changed the way we have to work together to be able to respond to those needs. We were quite fortunate in the sense that we've been planning an integrated response hub for some time, and we managed to get that to go live in March 2020 before the first lockdown. And this 24-hour phone line has been taking up to 400 calls a day, and it's been providing immediate advice and guidance and support. It can provide immediate access to mental health crisis services, but it can also help direct people's referrals and concerns to the right point in our system as quickly as possible. On top of that, we've also increased access to psychological therapies for mild to moderate mental health issues, and this included options for online and digital cognitive behavioural therapy. We're mobilising psychological therapies to be embedded in long-term physical health condition pathways. We're increasing financial resource to our third sector and to specialist services such as eating disorders and psychosis services, as well as putting more resource for psychology in inpatient mental health environments and increasing resource for psychiatric intensive care. The Crisis Cafe, the Crisis House and the Integrated Response Hub all involve a multidisciplinary team of third sector partners, clinical partners and sometimes local authority partners as well, working together to be able to meet those needs.
Well, the ICAN programme, Integrated Care across Northamptonshire, is a system-wide partnership transformation programme that's looking to better support people who are frail, whether they're living in their own homes or other settings. Some of the aims and objectives of the programme are to, I suppose, identify people sooner in that journey and to support them better and quicker than we've done as a system in the past. Key to it is working in integrated ways, so there's significant partnerships across the statutory and voluntary sector that will help us to do that, and what's been really pleasing as well is how we've been able to involve patients and carers in co-producing some of our early services in this area. There's lots of strain on health and social care in terms of demand on acute hospitals and frontline services. So we're hoping that working in this more early identification, preventative way to help people live well and age well will be really beneficial. One of the areas that's been really helpful in this is we have an excellent people advisory group made up of patients and carers, and they've been invaluable really in helping us to shape services and also reality checking what we're doing to make sure that that is the right things. So we've got welfare support teams that will be based around primary care network, so there'll be one of those in every area of Northamptonshire. We're also starting our first dementia hubs shortly, the first one being in Corby, and there's other exciting work on the dementia pathway, and we're also helping to deal with some of the backlogs that have built up in the systems during the COVID pandemic. We've also started the county-wide Befriending at Scale programme as well, which is supported via coordinators and volunteers, and that's already dealing with good volumes of people and will continue to grow over the next months.
The idea of an annual health check is that everybody with a learning disability from 14 years and upwards starts integrating with their GP surgeries, having their physical and mental health checked, and then having a health action plan that actually starts to integrate them into other systems, such as screening for cancer, screening for dementia, etc. So it's to actually make sure they're accessing the same health as you or I would.
Last year, the pandemic, we realised there was a problem. We were halfway through the year and we'd only managed 5%. We'd never been in that position before, and recognised that we needed a system-wide response to bring us back on track and help us reach at least 67%.
In addition to people being fearful to going into surgeries, obviously also GP surgeries were overwhelmed with the COVID pandemic. Northamptonshire Healthcare Foundation Trust and the CCG worked together to set up to support the GP system that we knew was struggling. The first thing that happened was nationally we all fought quite hard to allow for the 1 year only for a virtual check to be done, and a pre-questionnaire that would help people prepare for that virtual health check. That really increased numbers. The GPs also really wanted to address the seriousness of having low rates, so they started to really put a lot of resources into the annual health checks. And also Northamptonshire Healthcare Foundation Trust started to reach out to those people that perhaps traditionally weren't going to the surgeries or were still fearful to have their virtual checks, and they were offered health checks at home, which really is the situation for a lot of people. We also wanted to get a lot of publication and media out there about annual health checks, so we applied and won some funding for actually getting our Voluntary Impact Northamptonshire and our Parents Carers Association to actually do a lot of media work. So in addition to everybody upping resources to try and get the checks done, we had a lot of media going out there, and that really helped. And so actually, although we were meant to achieve 69%, we really came out on top, achieving 77%, which was fantastic for us and for our population.
Social prescribing offers the kind of help that doesn't come in a tube or a bottle. It will provide an increasingly important non-clinical means to address our population's social, economic and environmental needs in a more holistic way. People will be offered the support and advice necessary for them to gain a greater level of management and control over their medical conditions. Social prescribing starts with a conversation, in our service with a link worker, experienced in listening, empathy and helping an individual to identify the motivation to make lifestyle changes. Our service will be focused on those with greatest need and likelihood of benefiting, thus going some way towards reducing health inequalities within our county. People living with long-term conditions, mental health and well-being issues, and/or living in social isolation. We believe that social prescribing will ultimately reduce demand on higher cost clinical health and care interventions. At the heart of our link worker-led service will be a personal consultation and motivational interview. As a result, the individual will develop a personalised support plan, and the link worker will help in accessing whatever is needed, be it community groups, activities or clubs, legal or money advice, befriending, information and guidance. It is our objective to build sustainability and resilience in our communities and the VCSE sector through developing county-wide collaborative services that operate consistently and at scale.
So I was working in community pharmacy. I've been doing that for a number of years, and I was given the opportunity to come here at the vaccination centre, and I decided to make the move and help out during the pandemic. At the vaccination centre, so every morning I come here, I set up the whole the pods in the pharmacy. So I record the fridge logs, room temperatures, sanitise the surfaces, and then I get my files out, place them on trays. I have audit logs of everything of what is taken out from the fridge, placed on the bench for the vaccinators to come in and book out the vaccines, administer them to the patients and bring them back in and make sure they're recording each dose. Yeah, it's been really good, it has, because I've got to meet different healthcare professionals from different backgrounds. So I'm working really closely with doctors, pharmacists, nurses who are specialised in different areas. So it's been really good just to have conversations with them. I've met some amazing people here at the vaccination centre, and we're just glad that we've managed to vaccinate hundreds and thousands of people at Northamptonshire, because we've received our badges to confirm it.
Taken on quite a lot more face-to-face consultations with patients during the course of the outbreak. As well as that, we've had to arrange a lot more deliveries to patients to help with the isolation efforts, and we've coordinated with different agencies who have been volunteers from Northampton Fire and Rescue Service, the Northampton Advanced Motorcycle Unit called Farmer Bikes. We've had to do a lot of coordination for the delivery efforts, because we normally deliver around about 70 patients worth of medicines per day, but during the pandemic we've done somewhere in the region of 150 up to 200 a day on some occasions, and the additional workload to get medicines to people's houses has been a major undertaking.